Hi, Matthew Holt. Another quick THCV spotlight. I'm here with Pamela Stahl. Pamela is the president of Avalon Healthcare Solutions. You may never have heard of Avalon Healthcare Solutions, and must admit I hadn't until relatively recently. And they live in the world. They live in the world of this, which I just happen to have. This is the bill I was sent by LabCorp for the recent labs I had for my checkup. And Pamela, somewhere in the world of Avalon, you live in the middle of that. So explain to me a little bit, what does Avalon do?
Yeah. So we are the only comprehensive lab benefits management insights company. So what does that mean? That means that our company, our customers are health plans. So they hire us to create clinical policies for lab benefits. So we do the leverage evidence-based medicine to develop those policies via our clinical advisory board. And then we use our technology to ensure that patients like you, consumers like you, Matthew, get the right lab test per your physician's orders, and that you pay the right price based on your benefit that you have with your health insurer.
So there's two parts to that, right? There's three parts. There's what's the right lab, what's the right price, and then how do you actually do it. So let's start on the what's the right lab. I assume, I mean, I have no idea, right? This particular one, I mean, you can see I had a CB. As we're using me as a thing, I'll keep holding up. You can see I had a CBC, a lipid panel, an A1C, uric acid test or whatever. I have gout, so that's probably why I have the uric acid test. That looks like a pretty standard lab panel to me for like an annual physical for a 60-year-old broken down man, which is what I am. What is going on? But we know that within healthcare there is massive practice variation everywhere you look. We know there's
Absolutely.
massive ordering of testing, particularly imaging and stuff like that. Is that just as bad in labs? Are there people ordering stuff that is unnecessary, out to lunch, super expensive tests? I assume there are some of the genetic tests which get ordered, which are highly expensive and probably, maybe not indicated. Tell me what's going on in the world of sort of practice variation in lab ordering.
Absolutely. So let me give you some statistics if I can to set some
Please.
context. So first of all, there are 14 billion lab tests, billion with a B, lab tests performed every year in the US, driving 70% of downstream treatment decisions. And just like you, me as a healthcare consumer myself, I think every time we go to the doctor, right, whether it be for a primary care visit or any others, I can't think of a time I've gone to the doctor and not have a lab test done, either blood test or urinalysis. Those lab tests drive 70% of downstream treatment decisions. So we get those tests done and they're driving decision making, but you really don't. I think most of us don't really appreciate how important those lab tests are. And when I say important, it's important that the right tests are ordered and that the right tests are done at the right location. So certainly post COVID or during COVID, testing centers opened up all over the country, and
Right.
now those lab centers are looking for tests to do. 30% of lab tests that are done are unnecessary. 1 in 3 genetic tests are ordered in error. 85% of tests are repeated even after normal results. And then you add to it, there is waste in the system caused by something called panel stuffing, where labs say your doctor, Dr. Smith, says that Matthew needs to have these 3 tests. Well, in order to get those 3 tests done, they're a part of a broader panel of 20 tests. And you don't need the other 17 tests, but whoever's paying for your benefits, whether it be your employer, the government or the plan, is going to pay for that. And that panel stuffing costs the system $2 PMPM.
Which is not nothing. All right. So who is coming up with what are the, I mean, we hear a lot about practice guidelines, right? And appropriate care, and there are organizations set up like Choosing Wisely to try and get people into that. We know that practice guidelines, yeah, and there are government guidelines around when should people have mammograms and all of that stuff, right? Is there an equivalent body doing this for lab testing? What are the guidelines that you're enforcing?
Yeah, so we do it through our clinical advisory board, which is led and staffed, I guess you would say, by independent. I mean, of course, we hire them, but they are lab experts, clinical lab physicians across the country. And they, on a quarterly basis, look at the science and use that science to derive what appropriate testing should be, whether it be in routine testing or clinical testing. So for us, for Avalon, that indeed is the body that drives the actual clinical policies.
Is there a US Preventive Health Task Force, or is there some kind of specialty society that's not organized by Avalon that is producing these things, or is no one else doing it? Are you it?
I'm not aware of that there being a body like that, an independent body like that.
Okay, that's probably interesting. All right, so let's go back to the sort of panel stuffing. I've noticed a couple of things, right? One is that uh, there was COVID, and anybody and their dog decided they could do a test, and then you got the rush of at-home tests, right? So we are seeing a change where there are people trying to develop at-home tests. Obviously, there was the scandal around Theranos, but there are still people trying to figure out, can I do a test that can be done at home? Some areas like colon cancer, you can poop and dip into your toilet, and for colorectal cancer tests and stuff, and there are others now where you can drop a tab of blood on something, on a bit of paper, or, and similar to the COVID test where you were doing a swab onto the bit of paper at home. Where are we in the kind of moving test from the lab to the home? And has that been reducing costs and increasing access, or has that just been another area of testing that's sort of grown onto the system that no one's really controlling?
I would say it's the latter. So
Yeah,
it's moved onto the system and no one is really controlling, right? And so certainly if consumers are just getting those tests on their own and paying out of pocket, that's one thing, but not healthy for the system. And I know there's a lot of question about which of those tests should be approved by health plans to pay. We include tests like that in our approval systems to the extent that we can through our clinical advisory board as well, things like Cologuard and others. So
right.
yeah, they have been added to the system. And by the way, Matthew, you mentioned genetic testing. I'll throw another stat at you, but it's a big one. There are 175,000 genetic tests on the market today, with 10 new ones coming out every day. So not only and by the way, genetic testing, as you know, appropriate genetic testing is super exciting for driving of precision medicine, especially in oncology and other places like that. But it's exploding so quickly that payers are having a horrible time keeping up with all those tests. There aren't specific codes for payment. In addition, think about the physicians. Physicians, they're coming out so quickly they don't even know what to order. So, company like Avalon, we do manage genetic testing as well for our health plans.
All right. Um, let's let's move to the pricing part. That was the first part of sort of appropriateness and how you're dealing with it. And it's obviously a confusing big mess. On the pricing part, all I've ever noticed is that, is that this is the variance where traditionally, right, you get a hospital bill which has ridiculous numbers, and then there's the amount where it's marked down by the agreed charge or whatever. It seems to me every time I get my LabCorp bill that the amount marked down is like huge. So they're charging 500 and $600 per panel, and they're being paid like 22. Um, is lab pricing a problem? Is this because I'm not getting the wrong kind of test? If there are other tests, I'd be seeing, much more explosive pricing. Is it a problem overall? Is the amount of money we're spending on lab testing going up dramatically more than any other areas of healthcare? And who's winning in the sort of fight over price? The health plans and hospitals have all the time. Who's winning between health plans and labs?
Yeah. So yes, it is a problem. So there's a huge discrepancy in lab test pricing, and the biggest reason is site of service. So Avalon just put out we do an annual lab trend report, and our next one, the 2024, will be published next month. And in it, we found that the price for a general health panel, which is likely what you're referencing in your bill there, was $27 when performed at an independent lab. The same panel is $35 at a physician's office and $157 when it's done as hospital outpatient service. So 575% more than the independent lab price. We also found that hospital lab prices are growing faster than independent labs, averaging 46% from 2022 to 2023. So that site of service where you get your testing done can make a huge difference in the cost of that specific service.
And in terms of, working either through you or just directly, you know, there's the price and there's what they're getting. Are they getting, and you can see this. I've written this about medical bills, how much One Medical or UCSF manages to charge and keep compared to like independent physicians. It's in some cases 3-4 times the amount. We know that that price variation is not just in the sticker price, but also in the actual paid price. Is this the same case? Are health plans paying those hospitals 3, 4, 5 times the price they're paying independent labs?
Yeah, well, it depends. So
If they're
it
not your
depends.
customer, I'll put
Yeah,
that in
right.
there.
Right. So for our customers that hire us, the piece I didn't talk about that we also do is we also, if a health plan hires us to do it, we will uh, manage their lab network for them in
Mhm.
their state that they service. And so we negotiate those rates on behalf. And so for the where we negotiate those rates and manage and run their lab networks, our health plans see significant savings and don't pay that same amount.
But are you able to kind of intervene in the at decision point? So my doctor sent it to LabCorp because that's what he always did, or he sent it to the hospital because he's connected to them. How do you intervene there? That's pretty tough, isn't it?
Yeah, well, we catch it. So our editing, our tools actually catch that bill in between, and we match what was charged against what the negotiation can't talk negotiated rate should be based on what we've negotiated within that lab network. So basically, they become in-network labs, and they have to. What gets paid is the rate that we negotiate on behalf of our health plan.
So now let's go to the other part, right? There's a hospital. We have this. This is why the out of network surprise billing thing happened in the first place, right? The doctor, who maybe the hospital doctor may be in network, but who knows if the lab or the hospital he's sending him to is in network or not? What happens in that situation? So now the doctor sent my lab somewhere. I didn't know where the hell they were sent. My blood was drawn. Something happened. What does the plan do if it's an out of network charge? Or they say, sorry, we were going to pay $25. You charge 200, go off to the patient, or what happens next?
Members held harmless in our situation. So you would not see the difference. So the end of the day, the health plan, we partner with the health plan
Yep.
to do what we can to redirect. But the patient you would not get
Okay.
balance
So the
bills.
patient wouldn't, but the health plan now is saying to the is now basically saying you're an out of network lab. We're not going to take the deal, and the lab can say the hospital based lab can say, well, sorry, we're out of network, but we're charging you what we're charging you, and they have to fight it out. Is that basically what's going on?
And the pressure stays on.
Right. So let's go to the third part. Where do you plug in the system? Are you so you can set up a network with agreed pricing. You can set up which we discussed. You can set up like the appropriate things to be ordered. How do you intervene whether either it's an inappropriate order or it's gone to the wrong place and it's out of network and therefore the pricing is inappropriate? I mean, well, presumably the place you'd want to intervene is like as the doctor is hitting order on in the EMR. But is that where you get to intervene, or do you have to intervene downstream?
So the health plan will publish the
Yep.
policies and the fee schedules so that the providers know what they're billing against, right? And then those bills come in and we catch them and we match that against what the agreed upon payments and
Mhm.
policies should be. So we reconcile that on behalf of the plans. So that's where we play. But we also support our health plans too on the upfront with provider education, whether it be educating their labs for what they need to do to bill, or educating the physicians in their market so that they continue to get the support that they need. So we work with our plans as they ask us to for that as well.
How close are you to be able? So let's assume, five major payers in one market or whatever, and you're working with some subsection of them, and they're responsible for most of the bills as they are. I mean, how close are they to going to their big integrated delivery systems? And are you involved in the process of saying, right now your EMR automatically directs to your hospital lab, but actually, we want you to direct to LabCorp because we have a better deal, or we'll go in and negotiate with the, for the actually at that point of care to get people to the right
Yeah.
place. How close are we getting to the situation where you or someone like you is coming in and sort of redirecting so that this doesn't happen? You don't have to do the thing up at the back; it's been done up front.
Redirection. So that's a great question. Redirection can be difficult. We have several plans that have asked for our support to do that, but some of them are hesitant to do so based on we talked about hospital labs, right? So dependent on what their current in-network hospital contracts are, they may be hesitant to um, took them off, right, by redirecting. So depending on the other things they've got going with their
Yep.
hospital labs. So we're happy to partner with our health plan partners to support them in redirection efforts. But I wouldn't be telling the truth if I didn't tell you that that's a difficult thing to do.
All right. Fantastic. Very last thing, Pam.
Yep.
Pamela, oh, tell me about the company. How long you've been around, what you've been doing, how big you are, uh, how you're funded, and what's going to happen next with you.
So this company's been in business for 10 or 11 years, I think. We are a PE backed company. I've been with the company for just a year. We now have about 35 million members under management through our health plans and growing quickly. We've got about 25 health plans that we currently serve across the country, from regional health plans to some of the national players that you know.
Fantastic. So we have a PE-backed lab management company, which is, stopping some of those PE-backed medical groups and labs from making excessive profits. Welcome to America. All right. I've been speaking with Pamela Stahl. She's the president of Avalon Healthcare Solutions. Pam, thanks for your time. I really appreciate it.
Thank you so much, Matthew. It's a pleasure.